This is the Neurosurgery Podcast. Welcome back to the Neurosurgery Podcast. Today, unfortunately, without Dr. Wang, who is busy doing an emergency case right now, but nevertheless, we are delighted to be joined by Dr. Gabe Tender. Dr. Tender is a neurosurgeon originally from Romania, now at LSU in New Orleans, but he has kept strong ties with his Romanian roots and even gone back to work there as a neurosurgeon in his career. Dr. Tender's taken time out of his busy schedule to come on the show and talk with us about neurosurgery in America versus Europe as someone with very uniquely a foot in both worlds. So, Dr. Tender, thank you so much for coming on the show. Please take a moment to say hello to our audience.
Good morning, everybody. I'm Gabe Tender. I'm currently working at Louisiana State University in New Orleans. I do mostly spine and neurotrauma. And indeed, I am born in Romania, and I still go there every year. I used to go twice a year, but now it's just once.
Yeah, so let's get right into it because this is fascinating. We've been talking with European neurosurgeons since I got to go over to that EANS spine course. We've mentioned it on the show. And a big thank you to Anthony DeGiorgio, a good friend of us on the show who's been on a few times, who, when he heard about this, immediately said, "Oh, you got to talk to Gabe Tender. He operates in Europe and America. Who else? Who could be better to talk about the differences between the two systems? What cases happen and what don't happen, what the philosophy is between American and European neurosurgeons." So let's get right into it. And I'd like to begin just with your background. Born and raised in Romania, tell us a bit about what your childhood was like growing up there and when you first got interested in being a physician, much less a neurosurgeon.
Yeah, I mean, I can talk about this for hours, but I'm going to try to keep it short. So
Yeah.
I grew up in communist Romania. I was born in 68. And Romania was communist until 89. So,
Mhm.
for my whole young life up until 21 years of age, um, I was, raised in communism, and I am extremely biased against it, as you can imagine. Uh,
Most people who grew up under it are.
Correct, correct. So, I did my med school. So in Romania, you go from high school to med school. There's no college. But medical school is 6 years. So I did that in my hometown. And then, just to back up, I decided I wanted to be a neurosurgeon in high school in the 10th grade.
Yeah.
I did go to med school with the idea that I'm going to be a neurosurgeon. And I think that goes back to my fascination with the way the brain works. And, I had, when I was in the fourth grade, one of my classmates, she was hit by a bus and ended up dying from a
Oh,
subdural hematoma. So I think that also kind of steered me towards neurosurgery, brain related. And yeah, I got into med school, did my med school, and then I started the neurosurgery residency in Romania. I was there for 4 years. And in the fourth year, I had the opportunity to come for a scholarship in Chattanooga, Tennessee, just for a general surgery, preliminary residency program. And when I was here, so I already passed my USMLE tests back in Romania prior to that,
mhm.
but I would get no invites because of not having US letters of recommendation. So um, I came to the States. I worked with a neurosurgery group in Chattanooga. They gave me excellent letters, and then I matched with LSU in New Orleans, and then I stayed. So that's the short version of my, travel from Romania to here. Um, I don't know exactly which parts are you interested in talking about, because there's so many things, that I could tell you. Um,
Yeah, well, I mean, while we're at that part of your life and career progress, what was it that made you want to come to America?
well, several things. First, as I grew up in communism, there was a fascination with the United States, with America. Um, some people thought that France or Germany would be better. I always thought the United States were the leadership in the world, and they were and are. Um, so that was number one. Number two, I was highly motivated to leave Romania because the residency in Romania is very backwards. So the med school was great. So I still remember things from med school. It was phenomenal medical school. I think it's better than the U.S. And the students are very motivated in Romania.
Hmm.
Now, when you go to residency, everything changes. And the reason I say it's backwards is because I don't know, it's still the same. I think it still is the same to this day. The teachers, the professors of neurosurgery are afraid that you're going to take their spot. So not only they don't teach you anything, but they actually keep you from learning. I know it's
Wow.
backwards, and I will say this. I'm not afraid to say it. Um, I remember one of my professors there would not talk about anything like surgical planning, anatomy, and then a student comes along, and of course the student will probably not do neurosurgery, and he just showed her the whole plan, how the tumor is going to be approached. Of course that went right over her head because she was a student, she didn't know anything.
Yeah.
But I was like, wow, why can't he do that with us?
Yeah.
And it was just a very malignant environment in residency. um, I made the most of it. I mean, we put in the hours, and they wouldn't let you operate until towards the final years it was 7 years at that time,
Yeah.
and still is. And I think in my 4 years being there, I think I did like two small cases in 4 years, which is
Wow.
insane, right?
Yeah.
And there's a saying that every kick in the butt pushes you one step forward, and it's a translation from Romanian.
Yeah.
And I got kicked in the butt so much that I was like highly motivated to leave that system of training. And I'll
Yeah,
tell
so
you,
you've got the pull of America, and you make my patriotic heart swell with pride talking about wanting to come here. So you've got the pull of America, the push from behind of
yeah.
that does sound like a very malignant culture. I certainly hope that things have changed. I mean, that's the mindset of people who don't think they will ever need a neurosurgeon when they're older, I guess. Um, so then I guess talk a bit about you come to America, you're at Louisiana State, and then at what point after you finished your training did you even consider going back to do work in Romania as well? Because I know many people who have come to the States to work as neurosurgeons from many countries, India, Brazil, European countries, Canada, and I don't know anyone who did a new residency, has stayed in America professionally, but then goes back home to operate there as well. How did you even first think to do that?
I always kept in touch with the spine people in the
Yeah,
hospital. So when I said that the residency is malignant, there is one exception. The spine guys are super nice. Yeah.
yeah,
And and I kept in touch with them. I'm still very good friends with the head of the spine department. He's like, I want to say 3 years older than me, and I collaborate with him the most. But the way it works over there, there's two kinds of hospitals: the private and the government owned. The private hospitals are flourishing. The government owned have very little budgets. So I'll give you an
yeah.
example. They get per year 40,000 euros for the hardware, for the instrumentation. Forty
Wow.
thousand euros for a whole year. And they just buy a bunch of pedicle screws, and then they use them very judiciously. Like over here, we would do, a four-level fusion with bilateral pedicle screws. Over there, they put one screw at the top, one screw at the bottom, and the rod only on one side, and keep you in bed forever. Or not even that, they just keep you in bed forever until you fuse.
Yeah,
And they get very creative, and I can tell you about that. When you don't have any funds, get very creative in terms of surgical options,
Yeah.
and it's good and bad. I mean, I've learned things from them that you know would never be thought of here, because we have so much money to spend for these cases. Um, but yeah, I kept in touch with them, and in my training, I got lucky because right when I started my residency in neurosurgery here at LSU, the minimally invasive spine surgery was just taking off. So this
Yeah.
is 2000 to 2005, and if Mike Wang was here, he would probably confirm this.
Yeah.
Um, so I took it for granted that you can put a tube down and do a fusion and put screws percutaneous. All that stuff came to me like new. Like that's how I learned. That's how I trained. I
Right.
didn't know that at the time that was very novel. And then I got very good at it. I continued it, and in 2000, so I graduated in 2005, and in 2008, Stryker put together a course for minimally invasive spine, and I invited my three friends from Romania to come, and they sponsored their trip, their hotel, their flights, and they came here, and they were like, "Wow, this is amazing, but we don't have money for it."
Yeah.
So I said, "Look, the first step is to learn how to do these minimally invasive procedures. It's not going to be easy because you've done your whole lives open big surgeries, right? So you have to rewire your brain to learn how to do that." So the next year, I tried to go back to Romania and I couldn't. And then in 2010, Stryker offered to donate their first generation implants and instruments that were becoming obsolete in the States. And everybody won because they wrote them off taxes like a donation. And the Romanians thought it was the best thing since sliced bread.
Yeah.
And they were super happy with the original, first generation screws and rods by Stryker. And after that, I just went to different companies who were willing to donate, you know, implants and instruments. And there's been several of them: Globus, Nuvasive, um, Zovation. Now, I mean, there's been a lot of generosity, and of course, there's some financial interest because they're not going to be able to sell those in Romania in the States, so they just donate them to Romania, and life is good for the spine companies, and of course also for the Romanians. So I've been going there and teaching them how to do minimally invasive TLIF, and I had to be careful because these were my former professors. So like they you know taught me how to like suture and like simple stuff,
Right.
and then I come to the States, and in 5 years I learned more than they have learned in 30 years. And I go back to teach them, and initially they were skeptical.
Right.
They were like, "Ah, no, this is bull crap, and like this is not going to work." Well, guess what? Not only it worked, but Romanians are a lot more resilient. And I guess you wanted to compare a little bit the populations. I
Yeah.
think that in the States, by the time you have surgery, you have a ton of narcotics on board.
Hmm.
So Percocets, Lortabs, Oxy, hydrocodone. People take them before the surgery a lot, which makes postoperative pain control very difficult because
Right.
they're used to those narcotics. In Romania, I don't think they even have narcotics by mouth. So all they take is Tylenol and ibuprofen. That's it. And it's amazing how, you spend 6 hours of surgery doing, because I really taught the procedures. It would take me like maybe 2 hours to do MIT lift. It would take them 6 hours because they were just learning every
Yeah.
step. And I was just on the other side of the microscope and just teach them. And there were five faculty, so I taught all five, Um, but mostly my good friend Daniel, he was the one that I worked with the most. Um, and after 6 hours of surgery, they would extubate them prone, which blows my mind. Like take the
Yeah.
tube out while they're still like face down, and then they flip them and they start talking immediately. I don't know how anesthesia does that over there, because over here it takes like 3 hours to wake up.
Right.
But they keep them very light, no arterial line, no gas. It's called TIVA. I don't know if you're familiar. It's kind of
Yep.
technical, but
Yeah.
so they, after 6 hours, their eyes are not popping out like they do here because they don't overhydrate them, and they wake up immediately. And they ask them to move their feet, and like immediately, like within 30 seconds of pulling out the tube. I was joking when I went there that when you bovie, the flesh of Romanians smells differently. And it's true. Like, it's not the bovie. Yeah, it's the same bovie as here, but it smells, the smoke smells differently. And I was joking that it's the narcotics that gives the American smell, the different, to be
Right.
different. Uh, and then you see them post-op, uh, literally like an hour after the surgery, they're already on the floor, and I'm expecting them to scream in pain and ask for morphine. Nope. They get some Tylenol, and you say, "How bad is your pain?" And they're like, "It's burning a little bit." I'm like, and this is not once. The first time I was shocked, and then I got to expect it. And everybody is like, I got a little bit of pain. That's it. You know? I mean, I think Mike is a big proponent of doing MIT lifts awake. Romanians would be a perfect population
Yeah.
because they do not hurt. Like, their pain threshold is super high, I guess.
Well, maybe
Uh,
that could be the next technique you bring back home. So
yeah,
these days, how often are you going over there? And that's I wanted to get into. You touched on it a little bit. When you go, are you mostly just educating and training and teaching, but you're in actual surgeries with real patients, or do you see your own patients, do your own surgeries while you're there as well? You probably don't have enough time to,
no,
spend there for that long. Yeah.
no. It's kind of funny how they do it. They line up 10 people, and
When they know you're coming.
only five that get surgery. So
Uh,
you, and you.
yeah.
The other ones you can wait. Um, but yeah, it's a different system. Like, they don't care if the patient is in the hospital for several days.
Right.
It's not like here where there's a push to like get them out.
Yeah. So, what would you say? I guess we talked about the resource differences in terms of planning instrumentation and the patient resilience, which is very interesting. And, we see that a lot cross culturally in different places around the world. But aside from those factors, what would you say are some of the mindset differences between American and Romanian neurosurgeons, not just in spine? You also do trauma, and we see a lot of variance, and even in different places just in the states, about how aggressive people tend to be in treating head injuries, spinal cord injuries. What are things like in Romania in terms of aggressiveness overall as neurosurgeons, not just with instrumentation where there's cost issues?
Well, just remember that the funding is limited. So over here, anybody with a GCS of 8 or less gets an ICP monitor. In Romania, that's not available. So
Oh,
they may put a ventriculostomy and hook it up to a bag and determine what the pressure is with a column of water,
yeah.
the old school way. Um,
Water doesn't lie.
yeah, and then they may not even have uh, ventricular catheters.
Hmm.
So a lot of it is based on feel. You get a CAT scan and you think, oh, this is going to swell. Um, and in terms of more complex surgeries, they're really not as well trained as the U.S. Neurosurgeons. I mean, even their best technicians, neurosurgeons, technically are inferior to U.S. neurosurgeons because of the training. It really is because of the training. It goes back to what I told you. Like, in residency, you don't really learn anything. So after residency, you basically have to learn on your own.
Yeah.
And some of them are more talented than others, but you never get to the level of the U.S. neurosurgeons, because by the time you become a chief resident here in the States, I mean, there's nothing you cannot do. You clip aneurysms, you take skull-based tumors. Everything is ask the Giorgio. Um, you know how to do everything, and you don't have to learn. I mean, obviously, you're going to learn some after the residency, but not like in Romania. In Romania, you're almost like in your first year of residency after you graduate. Like you have to learn by yourself how to do these complex cases. And I'll tell you, the best brain surgeon over there didn't know how to use the microscope for a while. I mean, that blows my mind thinking back that he would use loops to clip an aneurysm.
Mm.
So, yeah, training does matter, and training over there in residency is very limited.
When you go over for your visits, do you have a chance to interact with residents and students and trainees as well? Or are you mostly one on one with the surgeons and hopefully some of the technical know how you bring is trickling down?
So there's two kinds of residents. Uh, just as a in parenthesis, in Romania, you take a test, three different things, and there's a list of um, like across the country. Let's say there's 1,500 people graduating in my class, in 1994, and we all take the same test across all the cities, and there's a rank list. So from 1 to 1,500,
Hmm.
and there's and they go in order, like first, second, third. I was 11th in my time, and there were, I believe, 15 spots for neurosurgery, a lot of spots for cardiology, a lot of spots for general surgery, and so on and so forth. The neurosurgery spots were taken either at the very top or at the very bottom because it's 7 years. And
Yeah,
if you don't have a passion for it, you don't want to spend 7 years in residency. But
right.
the top people who wanted neurosurgery would get like in the first few spots, up there with plastic surgery and the lucrative ones like
Yeah.
ophthalmology. Those would go first. So you get the top ones who really want to do neurosurgery, and some of those residents would come and operate with me and their faculty, and they would learn. Now, the bottom part that didn't have any other choices, those are the lazy ones who probably are going to end up somewhere in the countryside and not really do much neurosurgery. And it is what it is. There probably shouldn't be that many spots in neurosurgery. That's part of the problem. They don't limit the number of resident positions to have enough room like we do here. When you graduate any program of neurosurgery in the States, you're guaranteed a place to work. In fact, the world is your oyster. You can choose where you want to go.
Yeah.
So it's not like that there. Um, so yes, I was involved and am involved with education. The residents, even the students. Those who are interested. I have been a little reluctant to scrub in lately. So every time I go, I still, take like $500,000 in implants and instruments, and I give it to them, and I make rounds with them. Do some education. I tend to not scrub in anymore because number one, they know how to do it. I mean, they've been doing this for 10 years with me, and number two, the Romanian population has become more litigious,
Yeah.
and I have no coverage over there. And I'm concerned that some guy or gal is going to be like, "Oh, this guy is coming from the United States and he maimed me. I'm in so much pain, you know, and I don't have coverage there,
Yeah.
so it could get ugly." So I've been, you know, giving them what they need, but not like actually actively getting in surgery with them. But the five faculty, they all know how to do it, and I hope they teach their residents now how to do that technique.
Yeah, well, what a frankly inspiring story. You think about someone who leaves home, goes to the other side of the world, and then just thinking about what you've brought back to your mentors, your program, but also your country, with as you said, now these people know how to do these techniques. They'll teach the next generation. It'll trickle down. What a beautiful thing you've done for your people. I wonder if, as we, I want to respect your time as we come to the end of this conversation. You talked about how you still go, you still come to educate and watch, and you bring materials. Looking forward for future trips, future visits, what are your hopes for what else you could bring back to your colleagues there, and for the future generations of surgeons there? If you can try to imagine for the rest of your career that you'll still be going back and visiting and teaching, what are some other things that you'd like to achieve and to bring to those surgeons and friends back home?
Well, at the end of the day, if you don't change the system, uh, you don't change much. And I've
Hmm.
been trying to implement, and not just me, but the five faculty that are the leaders of spine in Romania. We've been trying to establish whatever you want to call it, a center of minimally invasive spine where people from other cities and other hospitals would come and learn. And it's not easy. It takes a few cases to, like, become proficient, even if you're talented, like Di Giorgio. But if these doctors would come from all over the country to this place and get certified by the guys that I trained, all of a sudden this would become the system would change, and everybody would learn minimally invasive spine. And I could actually teach them some other techniques, not just the MIT lifts, as time goes by. Um, and I tried to do that, and you have to have the support of the government. And I somehow got connected with the guy who was in charge of this whole thing. Matter of fact, at some point, he wanted to take me to the president, believe it or not. And we talked about it, and he's like, "Oh yeah, we're gonna establish this center. It's gonna be easy. We're gonna have 6 doctors at the time coming to, like, learn." And I'm like, "Well, that's great." And the next month, he was fired.
Ah,
So all that fell apart. So it is a high turnover in the Romanian politics, and there's a lot of mistrust, kind of like here actually,
yeah.
uh, for the politicians. But that would be my ultimate goal, is to establish, some sort of program where people can come and learn, and it would obviously be free. I don't have any, financial interests over there, but if that would happen, it would be really good because minimally invasive spine, I think, makes a big difference.
Yeah, all you need is the right politician or a wealthy Romanian with back pain, and then you'll
Yeah,
you'll get someone to bankroll
you're
it.
not wrong.
Yeah.
You're not
Well,
wrong.
that's phenomenal. Best of luck with that, and I truly hope that when the Romanian Center of Minimally Invasive Spine is open, we can have you back on the show to talk about it and
Would
share
love
the
to.
story of the inevitable, I'll say, success with that. But for now, this has been an incredible insight, for me at least, about the different philosophy, but also the training culture there. That's a very unique kind of training culture from everything I've heard described in different countries around the world talking on this show. But I think the greatest takeaway for me from this conversation is the Bovie smell. I'm going to be thinking about that one. But for now, Dr. Gabe Tender, thank you so much for your time and coming on the show.
Thank you for having me.